Are you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join Doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
As promised, we are back with Kim Downey, our advocate for physician well-being and super connector. And Kim, you have a YouTube podcast called Stand Up for Doctors. Tell us about it.
Sure. So I'd like to share the nature of how I came up with that name. So I was going for a walk one day, and I was thinking of all these, different names and titles. And what I was thinking is, when I interview doctors, I'm raising their voices and elevating, and I'm like, stand up, doctors. Raise your voice. Let everyone know what you have to say. But then I was also, of course, me as an advocate, being a patient for doctors, is I feel like other people need to stand up for doctors. And Dr. Kathy Stepien says everyone wins when physicians are well. And I feel like patients need to understand that, even if it's for selfish reasons. If you want doctors to be there for you and be healthy physically and emotionally, you need to care about them. So that's why it's called Stand Up for Doctors, and the "for" is in parentheses. So when I'm interviewing the doctors, I'm saying stand up, doctors. And when I'm interviewing others, I'm like, we need to stand up for doctors. And I have an exclamation point because I have a lot of energy.
You do have a lot of energy, and you were sharing it with us just how much work you have put in to your advocacy. And we forgot to say the word fierce. So you are not just an advocate for doctors, you are a fierce advocate. And just in the short time I've known you, Kim, remember listening to your very first podcast on Stand Up for Doctors, and somehow our paths crossed, and we've gotten to know each other a little bit even more over the last few months. And that advocacy shines through. Your heart is like as big as the entire USA. It is seen through all of the actions you do. I'd say fierce and tireless. Kim Downey, Stand Up for Doctors, would be my input for what I have seen for your work. And maybe you can share with us some of the different guests or what you've learned in that advocacy for doctors. And maybe it's even affected you as a patient.
Yeah, well, I have to say that before all of my health challenges, I was like a regular person. I would go to the two doctors once a year that tell me I'm fine, see you next year. And so, although you could probably tell that I'm a kind person, right? And as a physical therapist and as a patient, but I wouldn't say I had any deep relationships, with my doctors. But now, through the things that have happened, and through having cancer 3 times, and now being on medications that I need to keep me alive, because one of them was thyroid cancer and my parathyroid's removed. So I'm on medications, to keep me alive. So I literally need doctors to keep me alive. So I better darn well appreciate them. And that I've had, through the negative experiences, I did have a few poor experiences, and I had to change those doctors out. So I'm blessed to live in the Northeast, where I was able to do that. And then it makes me even more grateful for the wonderful doctors that I'm blessed to have now. And it's not an exaggeration that I would do anything for them. And they're just in my heart all of the time. And then, as I've gotten to know the doctors on LinkedIn, and when I have them on my YouTube channel, every person, I don't take for granted at all that they're willing to trust me to tell me their story and to share their story. And that's how every single one of them is in my heart. If you've been on my YouTube channel, truly. So I feel like, my heart is pretty big.
That is so beautiful, Kim. Like my eyes are tearing up, and I can feel you as you're talking, and the passion. And yes, Erin, thank you for bringing that up. I wrote it down and didn't say it out loud. Fierce. That you got me at fierce when you said, "Tell me about you," and that was the first word that came out. So it's very genuine and so connected to the rest of us. And what a beautiful thing you're doing. Thank you, and keep it up.
And as one of the guests on your show, Kim, It was a blessing to me because, as I shared in our last episode, if you haven't listened to that yet, go back and listen to it because Kim is our guest and we talk about Cards to Warriors and Don Veselka, who is one of the co founders for that nonprofit organization, bringing uplifting messages first to patients with illnesses and now to healthcare providers. And that's officially kicking off for Doctors Day on March 30th. And I wouldn't have had that connection with Dawn had I not been on your podcast and had you not been such a super connector. I'm so grateful.
Thank you very much. And I love it that it seems like the people that I pair up were meant to be paired, and then they're able to connect and support each other. I recently had on Dr. Afreen Sharif, who started Citrus Oncology, and she is an endocrinologist who helps with side effects from cancer medications, endocrine side effects. And I paired her with Dr. Mary Lung, who is a hematology oncologist, and they had never met. And Mary was so interested in hearing what Afreen had to share. And now they're able, that's just one example that they're able to support each other. And that has happened so many times. It's just really beautiful to watch.
And not everyone has the ability to do something like create a podcast, but is there something that people can do if they're inspired to stand up for doctors like you've done?
Sure. And whether it's patients or doctors asking a colleague, like truly saying, like, how are you doing? And I know for myself, when I was going through cancer treatments, and if somebody would just see me and they say, oh, how are you? You just say fine, right? That's what you're supposed to say. But sometimes I was at our local grocery store parking lot and I would run into someone from my church and they would say, when they'd ask me how I'm doing, I said fine. And then they're like, how are you really doing? And then I would share a little more because it might not have been a good day. And then when you ask the second time or ask in a different way, you know that they are genuinely interested and it's not just a pleasantry. So if you are a doctor for a colleague, or if you're a patient, and in some cases, depending on the relationship with your doctor, it's okay to ask them how they're doing, and it might, they might not share much, but I can guarantee you they'll appreciate that. Wow, you thought to ask me how I'm doing. And another one for doctors is self-care. Is like they've been saying self-care isn't selfish, but they keep saying it. So that means more doctors need to hear it and they need to know it, that you need to take care of yourself, because you're trained in your medical training to put the patient comes first, and the patient can always come first. If you're drained, then you're not going to have the internal resources to take care of your patients. So anything we can do to support, physicians with their own self-care is paramount. And then we all need to make time for a connection. I know one doctor just shared in a post yesterday or today that a friend reached out and wanted to go for lunch, and she had to turn her down because she was too busy. So it's like a kind of triaging. What can you say no to, right? So that you can make time in your life, because it's all about connection and making time in your life for connection. And what patients can do is, again, a simple thank you. When you're at the end of your doctor visit, just saying thank you to your doctor. I really appreciate what you're doing for me. Sending a thank you note afterwards, and also to the other staff. I started making sea glass hearts for my doctors, and I've given them to all my doctors, and now I've been sending some out. And my friend knew that, and so she crochets. So she had some scraps, and she crocheted some hearts. And I had to go see my gynecology oncologist, and I had already given her a sea glass heart, but it would happen to be Valentine's Day, and I brought the crocheted hearts for the office staff. And the administrative assistant put that one right out, and she put it right on her bulletin board, and she says, like, oh, I'm going to share these with my friends. So, the littlest things to know, because I said, I know your job is hard. Like, I've heard her, I've been sitting there when she's on the phone with people that might be yelling at her, right? And that someone sees them and recognizes them. And, be kind. We can all be kind.
All so important, and everything matters. feeling seen and heard. How beautiful. And we're not doing enough. So love all the details here, because you're right. We sometimes, in a good way, we think of something big, but then we don't end up doing anything because we think so big, and then we don't even know how to start. And something as simple as saying, how are you really doing? I always say that fine is the bad letter, like the 4-letter bad word that doctors, that starts with an F. I never say that correctly, because and we believe it. We're like, I'm fine. And we don't always even ask ourselves the second question, am I really fine? And to dig deep. And how beautiful to be able to do that with someone else. Thank you for all these nuggets. We have to make a list out of this and practice it daily. This is, we talk about formulas and frameworks, and this is a framework that we're creating here, that you shared with us, of what we can do as physicians, as colleagues, as patients, as friends, to create a difference everywhere in life. So this is how cool. Very, very cool. Thank you. I wanted to ask you something different. So the title of our podcast that we love, it's Create Meaning in Medicine, Rewriting the Rules for Women Physicians. And we love to hear, how have you created meaning in medicine and in your life?
Well, that's an interesting question because I feel like it's a work in progress. So I don't have a polished answer, but maybe that's okay itself, because I know like a lot of doctors might feel like, well, I want to do something different. Things aren't quite right in my life. And as my physician coach, Dr. Michael Hirsch, says, is you don't have to know the how, you just have to take the next step. So I've been trusting him because I didn't plan on doing any of this. So it's like I simultaneously know what I'm doing and I don't know what I'm doing. So I know what I'm doing because I have lists of things to do every day, but I haven't quite figured out on a grander scale, like, what is this? What is this going to turn into? And I only turned it. So I have a Substack newsletter along with the podcast, and that's also called Stand Up for Doctors. And I just registered as a sole proprietorship on December 30th. And now I might turn it into an LLC. So I'm trying to, figure out, like, what am I doing? But if you just keep taking the next step, and now, when I plan this, physician retreat, like, that's something else. And then when I'm, planning the rooftop party in New York City, that's, you're just taking it one step at a time, and, allowing yourself to be open to opportunities. And actually now I'm compiling a book of physician stories from the YouTube channel episodes, and I have someone helping me with that. So this is all involved, and that's why I share that you don't need to know everything before you start. And it was, again, Michael Hirsch that told me that, because it just feels so uncomfortable to be in the middle and not know where it's going, but you have to be able to sit in that discomfort and just be open to the possibilities.
That is amazing, Kim. I love how much you have shared with us, not only in this episode, but in the prior episode. If you have not listened to that prior episode, go back when this one's over and take a listen, because Kim Downey, you have shared so much hopeful, inspiring information as a fierce physician advocate, as a patient. And I just get chills thinking of that positive ripple effect that you are creating. And I would also, we've talked about upcoming Doctor's Day, March 30th, 2025, that you and I are involved in doing advocacy work and card writing. You've talked about your podcast, Stand Up for Doctors. And where else can we find you, Kim Downey?
Well, besides the YouTube Stand Up for Doctors, there's the Substack newsletter, also called Stand Up for Doctors, and LinkedIn. I'm always on LinkedIn.
And is that Kim Downey?
It is, yes.
Okay, awesome. I know that we're connected on LinkedIn as well. And if you want to find more inspiration, go to find Kim Downey on LinkedIn, or go listen to her amazing YouTube podcast of Stand Up for Doctors. And with that, we look forward to seeing you in our next episode.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.